I was going to start with just a few facts. So did you know, and probably many in this room already know this, but among people over the age of 65, at least 90% take at least one drug per week. So there's about 120 people in this room. About 100 people in this room take at least one drug per week. More than 40%, so about 50 people in this room, probably take at least 5 different drugs per week. 12% take 10 or more drugs per week. People over the age of 65 are also more likely to have more than one chronic medical disorder. And most of the drugs that are used for chronic disorders are taken for years or indefinitely. Women typically take more drugs than men. If you're wondering why, I think it has to do with some men don't go to the doctor as often because they're trying to be tough and don't think they need medication. That could only be one reason. So medication is the most common treatment for many diseases and conditions seen in older people and persons with disabilities. In the past several decades, many of the improvements in the health and function of older people can be attributed to the benefit of modern medication that includes longer lifespans, improved health, and better quality of life. So medications not only treat and cure diseases that were untreatable just a few years ago, they help in the early diagnosis of diseases, prevent life-threatening illnesses, relieve pain and suffering, and allow people with terminal illnesses to live more comfortably during their last dying days. For example, vaccines help prevent infectious diseases like influenza, the flu, and pneumonia that once killed many older people. Antibiotics are often effective in treating pneumonia and many other serious infections. Drugs that are used to control high blood pressure actually can help prevent strokes and heart attacks. Drugs to control blood sugar levels, like insulin, enable millions of people with diabetes to lead normal lives. And these drugs also reduce the risk of eye and kidney problems that diabetes can cause. Drugs to control pain and other symptoms enable millions of people with arthritis to continue to function. Yet, up to 1/2 of older people do not take their prescriptions as directed by their doctor. When not used appropriately, effectively, and safely, medications can have devastating consequences. That's why I'm here today to talk to you about the challenges that the older population might face in understanding their prescriptions. I'll also offer some solutions and talk to you about resources that are available. So what is the problem? There was a recent study that looked at over 59 people who lived in the community that were over age 70 in the Netherlands. With those 59 people, they identified over 200 practical problems that they had with their medications. And 184 management strategies were identified. 95% of these participants had one or more practical problem with their medications. That's almost everybody. 17%, so almost 1 in 5, had a potential clinical consequence with their problem. And 5% had potential to cause moderate or severe clinical deterioration. So some of these practical problems that were identified have to do with reading and understanding the instructions for use on the medication. So some people are worried about the side effects. Handling the outer packaging, so having to use a knife or scissors to get the outer packaging open. Handling the immediate packaging, so breaking the tablets or the tablets crumbling when they're trying to get them out. Opening those containers that are really hard to open. Preparing before use, so being able to identify their medications once they're out of the package, since that little white pill looks like all of the other little white pills. And taking the medication, so getting the pill stuck in the throat, or having problems with the flavor of the medication. So I've divided this up into 10 different challenges, and I'll go through each of those individually. So I'll go through side effects, drug interactions, vision problems, hearing problems, swallowing problems, dexterity problems, memory loss, scheduling, logistics, income, and social isolation. So any person could have more than one of these problems at a time, and all of these things can be challenging when trying to take medication as prescribed. So we'll start with the side effects. People over the age of 65 are actually twice as susceptible to the side effects as younger people taking medications. Now, sometimes people come into the pharmacy and they'll read that list of side effects and say that all of those happened to me. It's not usually the case. All of the side effects have to be listed, but there are some that happen more often than others. Some of them are really rare, but some of them are also really serious. These side effects in the elderly population can also become more severe because of different changes in the human body after the age of 50. And these effects can sometimes lead to more visits to the doctor or to the pharmacy, or even lead to hospitalization. For example, some medications that people take for their blood pressure could have controlled their blood pressure very easily at the age of 40, 50. They're still taking that same medication at age 60, 70, 80, and with that same dose that was fine before might now be too much in a person who's elderly, and it might lead to side effects like dizziness, lightheadedness, and make them more likely to fall. A lot of other common drugs, things that people take all of the time, like medications for mood, antidepressants, antihistamines, so medications for allergies, medications that are over the counter, in some sleep products. A lot of these medications have what we call anticholinergic side effects. And that can lead to confusion, blurred vision, constipation, dry mouth, and difficulty urinating. So those are side effects of those type of medications that might be more prominent in an elderly person and actually can become a severe problem if it's not known. Drug interactions. So older people tend to have more diseases than younger people, and so they often take more drugs than younger people. Having said that, they're more likely to have drug disease and drug interactions. And in some cases, these can worsen a disorder, a symptom, or a condition. For example, some medications that are used maybe for sleep or for agitation with certain side effects can make someone who has Parkinson's disease, make them have worse symptoms. Another example would be someone who's on a certain type of blood pressure medication and they have some arthritis pain and go into the aisle and buy something over the counter like Advil or certain cough and cold products and thinking it's perfectly safe because it's over the counter and it doesn't require a prescription, that could interact with some of the medication you're already on. A solution to that is to use the same pharmacy for all of your medications. When you're buying your medication from the pharmacist, then they're able to know and they're able to analyze the different potential drug interactions and can counsel you on them or let you know which ones might not be such a good idea. But that really only works if we know all of the medication that you're taking. If you're taking a lot of natural health products, there are some of those natural health products that people might think are perfectly safe because they're natural, and if taken along with certain prescription medications, they can have some pretty bad side effects without you even knowing that that was the problem. So always please tell your pharmacist or your doctor all of the medication that you're taking, including those over-the-counter products and natural health products, vitamins, herbs, supplements, everything. Vision problems. Not being able to read the small print on the labels or being able to tell which pills apart might lead to potentially harmful misuse. Pharmacists are able to print the labeling in larger print, so if that's an issue, then you can ask for the medication labels to be in large print. And also you can have the pharmacist read over the information before you take it home. Hearing problems can impede an elderly person's ability to hear and to understand the medication instructions. So always ask for the instructions in writing. You can ask the doctors, nurses, and pharmacists to speak louder, or bring someone with you who will be able to hear everything that they're telling you, so that if you have questions after you leave, you didn't catch it all, you can ask them about it. Swallowing problems. So some seniors, and even younger people, have trouble swallowing tablets or capsules. So some people might think, I'll just crush that little tablet, I'll mix it in with some applesauce or some yogurt, and then I'll be able to swallow it. There are some medications that are formulated in a specific way to act in a very long period of time. So some pain medication, for example, have a 12-hour or 24-hour release mechanism. So if you crush that medication, you'll get all of the effects at once, and then you won't have that sustained release that the pill was supposed to have. On the other hand, there are some medications that have a coating on them so that it's protected by the stomach acid so that it can get absorbed in the right part of the intestine before it can work. So if you crush that medication, it's not going to work. There are some medications that it's perfectly fine to crush. You just have to know which one. So always check with your pharmacist before deciding to crush or split or chew on certain medications. A lot of different medications also have formulations that are available as liquids or suspensions. So if you're having trouble swallowing it, you can ask for a different version of it. For dexterity problems, so a lot of seniors with arthritis or Parkinson's or the loss of fine motor skills, they might have difficulties opening the medication vials. Even I have a hard time sometimes opening a medication vial that has the child-proof tamper cap on it. Other examples might be the eye drops. It's very small. Inhalers, trying to figure out how to use them. There's a lot of new ones on the market now. Some of them you have to press and then breathe, and other ones you have to shake. So just knowing what to do with those things, and if you don't have those fine motor skills, it might be harder to use those types of medications. Or with insulin injections, turning the dial to get the right number of units. All of those things can be difficult if you're not able to use your hands as well as someone else. So you can ask the pharmacist to get the easy open caps, the ones that just flip up, and those are easier for some people. You can ask the pharmacist to pre-split the tablet, if that's something, if you need half of a pill for certain medications, or ask a caregiver to help administer the medications, like eye drops, for example. Memory loss is also an issue. So people with dementia or Alzheimer's disease might forget to take their medication, or sometimes take them twice because you forget that you've already taken it that day. So a solution for that is to use pill organizers. So a lot of different pharmacies will offer blister packs as well, where the medications are all put into their own little slot, so you know exactly when the medication needs to be taken. Is it morning, lunch, supper, or bedtime? And then the medication, when you see it's gone, then it's been taken. Some people can also use alarms, set alarms to remind them to take their medication, or some smartphone apps. Don't know if people use those, but those are available as well to remind people to take medication. Scheduling logistics. So having to take more than 10 medications in a day can become complicated in knowing when do I take this one, when do I take that one, and trying to work that into a really busy schedule. That's where those pill organizers really come in handy, or the blister packing, because it'll be set up for you. Pharmacists can also set up a schedule so that you know when it's best to take certain type of medication. So some should be better taken on an empty stomach, or some should be taken with food, or some shouldn't be taken in combination with other medications, so we can help you set up that. For income, low-income elders or those on a fixed income might not have enough money to buy the medications they need. Medications are expensive. So some people will split the pills or cut back on the prescribed dose, or even skip doses for several days if they can't afford their prescriptions. One of the solutions is to use generic medications. So for the most part, generic medications have the same effect as the brand name medication, but they're significantly cheaper. You can ask about prescription assistance programs, and some drug companies or manufacturers also have discount programs that are available to people on lower incomes. Many people who live alone often don't take their medications as often as people who don't live alone. So there are some solutions for that, and getting some in-home help and considering some home health care, or having a family member come in periodically to check up to make sure that medications are being taken. So finally, I'm going to review some of the key points, and I guess one thing is to remember to share the responsibility. So So pharmacists, doctors, nurses, speech-language pathologists can help with your health care, but the patient has to be responsible as well. So some of the things I'd like you to keep in mind is to keep an up-to-date list of your home medications. And that includes prescription drugs, non-prescription drugs, over-the-counter products, vitamins, natural health products, inhalers, eye drops, patches, injections, creams, and ointments. Some people just think pills are medication. There are a lot of different medications that don't just come in the pill format. So keep an up-to-date list of what you're on. And know what your medications are prescribed for. You might have been prescribed something 15 years ago that was needed back then, but it might not be needed anymore. So we like to de-prescribe sometimes as often as doctors like to prescribe, because not all medications are needed to continue all the time. Take your prescriptions as directed. So if you have an issue with that, speak to your doctor to know, or your pharmacist, what the challenges are and what are the barriers of why you can't take it as it's directed. Get all of your prescriptions filled at the same pharmacy, and that's to make sure that we can be watching over you for all of those drug interactions. When a prescription gets dropped off at the pharmacy, it's not just counting from the big bottle to the little bottle and then slapping a sticker on it. All of the behind the scenes work is actually reviewing, is this the right medication for this person, for the right indication, at the right dose, at the right frequency, in combination with all of those other medications. Will there be a drug interaction? Will there be a combination of side effects with all of those medications? So we need to know all of the medications you're on, and the best way to do that is to use the same pharmacy for all of your medications, or let your doctor, pharmacist, nurse, practitioner know what all of the medications you are on. Discuss any medication challenges with your pharmacist so that they can help you, and consult them for tools and resources. Community pharmacists are also able to do meds checks. So if you go in, they'll review all of the medications that you're on, explain what they're all for, and then the next time you're in at your doctor's appointment, you might need to review and see, are all of these still needed? At KGH specifically, because I'm a hospital pharmacist, I don't work in community, one of the programs that we do, and that we're striving for 100%, is that all patients admitted to Kingston General Hospital have medication reconciliation upon admission to KGH. So what that means is we gather the best possible medication history from the patient or their family or their caregiver when someone's admitted to hospital. It's a full, accurate, comprehensive list of all of the home medications. That list then follows the patient until either they're transferred or after post-op or until discharge, so that when the patient's leaving the hospital, the patient gets a list, a printed list of all of the medications from home that are the same, which ones have changed, which ones are new or different, and which ones to stop.